I would say I would prefer we were all in person, but again, we are here via Zoom, like many other meetings, still being careful about the well-being of everybody who attends these meetings. So hopefully, I'm crossing my fingers, maybe the next time around we will be in person as we have in the past, so that we can meet and greet each other outside of these Zoom meetings. So again, welcome. I just want to go through quickly a list of executive committee members that I see present. And if I don't call on you and you're here, please speak up so that we know who's here from the executive committee. I have Jeffrey Norman, Interim Chief of Police, City of Milwaukee. Superintendent Chantel Jewell from the Milwaukee County House of Correction. Dr. Connie Kostelak from the Medical College of Wisconsin. Shakita LeGrant McLean, Director of Health and Human Services, Milwaukee County. Tom Reed, Regional Attorney Manager with the Wisconsin Public Defender's Office, and Neil Thorson, Regional Chief, Wisconsin Department of Corrections, Community Corrections. There are other individuals from some of the organizations represented by the CJC Executive Committee, and then we have some additional named council members that I think are on as well. Did I miss anybody from the CJC Executive Committee? Okay. If I do see anybody as we move along, please just, Mandy, let me know and I can call out the attention to their presence. So again, thank you everyone for coming. As you can see from the agenda, the CJC is working diligently on a lot of different kinds of projects. I know we keep Mandy busy on a daily basis, helping us navigate all the work that we want to do. We have a lot coming up, so I'm going to go directly to our agenda unless anybody from the executive committee would like to say anything else. Okay, great, thank you. We have with us Interim Chief of Police, Jeffrey Norman. He has agreed to give some remarks and a brief update of the work that he's doing with the Milwaukee Police Department. I know he has to go on to another meeting, so we're going to get him in, see if there's any questions for him as well, and then thank him for being here. Chief, go ahead.
Thank you, Judge. I'd like to thank Mandy and Judge Triciano for the opportunity to address you all. As a longtime participant of the CJC, or Community Justice Council, I understand the importance of the collaborative effort. I know this is a great example of a collaboration that has been consistent and around for a number of years between the criminal justice system and our community. MPD is committed to be involved in this. We are strong supporters of this effort. In fact, efforts such as the VR-PHAST is one of the many examples of us working together with the community and our partners in regards to understanding there are multiple ways of addressing our collective issues within our community, and that we need to be at the table to be able to be part of the impact. MPD is committed to continue to data share with our multiple partners in regards to what we're seeing, what is the information that we're bringing in, and sharing it for action with all of our partners from the government and also community stakeholders. Because it's important that I always say all hands on deck in regards to how we all can impact the issues that are affecting our community. I do understand there's a lot of work to do. I understand that we still have a number of mirror issues coming out of our criminal justice system, coming out of MPD, and that working together and being able to hear the voices of those who represent the multifaceted aspects of our community, both from a community stakeholder, from the business community, from our criminal justice partners. It's important for us to all be at the table to be able to have these conversations and figure out solutions in a collective manner. Again, I'd like to, reassert that we are strong supporters and also active participants in this process. We'll remain in this process. We'll be part of the opioid task force. We'll be part of different issues in regards to issues of incarceration, understanding that we all have a voice in this particular manner. a voice to be a part of, the reckless driving and the violence that's affecting our communities, because it's not only one entity that's responsible for the safety and security and the being proactive within our communities. It's all of us. So again, thank you. I don't want to take too much time in regards to, saying all the big things that, we like to be a part of and are a part of. I'd just like to say that I am committed to be a part of the conversation, and that at the end of the day, I want to be part of the solution and not be a part of the problem. So thank you all. May you all remain safe, and, please stay healthy.
Great. Chief Norman, thank you so much for your comments and your willingness to work together to problem solve all the myriad of issues facing our communities, and do it as part of the Community Justice Council. We much appreciate that. Are there any questions for Chief Norman? You can put it in the chat. I can't see hands being raised, so if anybody wants to throw out a question, willing to have him answer that before he leaves. I'll wait for a few minutes in case anybody's typing.
Well, I know I do have a town hall tomorrow and one over the weekend, so I definitely understand there may be some questions to be held over for that.
Chief, there's a question in the chat, I think from TMJ4, around the recent accidental shooting of a 9-year-old boy in Milwaukee. I don't know if you can or want to make any comments on some of the violence facing the community.
Absolutely. The situation is an ongoing investigation. I know that we all unfortunately see the reports of many of our children in our community being affected by the negligent handling of firearms. Unfortunately, I can't speak on that particular one at this particular moment. We will have updates later on, but we do see that there is a issue in regards to firearms being available to our children. The responsibility on those who are in possession to make it safe, to ensure that you are making your particular residence safe. This is an ongoing problem within the city, and I know that we are working in concert with a number of different Common Core and Common Ground and other entities out there to promote gun safety, understanding that it's a responsibility on those who are guardians. It's always disheartening to see our children being harmed or being unfortunately killed by negligent handling of firearms. So being at the forefront and being in a partnership with our community stakeholders to continue to have the messaging in regards to responsibility and understanding that we all have a hand in making our community safe for our kids.
Great, thank you. All right, Chief, I know you're extremely busy. Thank you so much for being here, and we will continue to see you at our CJC Executive Committee meetings as well as the meetings of the whole. Much appreciated.
Thank you, ma'am. I'll be on for a little bit, but definitely when I go, it's not that I don't want to listen anymore, but other meetings. So thank you all.
And I think your last comment about collaboration and working together to try to problem solve some of the issues impacting our community is really important. And I would segue to the next agenda item. The CJC, in particular, the executive committee and others were very instrumental in the beginning when the pandemic hit for us to work together to make sure our justice system kept running, to put in safeguards to protect people's public health as well as their safety. And no doubt a group of individuals, including the executive team, got together to start to try to look at, not only pandemic related issues, but the increase in violence in our community, the increase in the homicide rate, non-fatal shootings, suicides, overdoses, and reckless driving. And what that group, when they started to meet, we started to pull other people in, and the violence reduction, public health and safety teams were born. And the VR-PHAST, as we call it, has continued to meet, to work together in a problem-solving fashion with people from all walks of life, all organizations, because we know that it's imperative that we have to find collaborative problem-solving solutions to some of the issues facing our community. And so I am going to turn it over to Dr. Connie Kostelak to give an update on some of the workings of VR-PHAST at this time. Dr. Kostelak, Connie, thank you so much for being here and your willingness to give us an update.
Thank you so much, Chief Judge. I really do appreciate that we are taking the time to talk through this today. And I know that we've had some conversations surrounding various aspects of the work that's happening in a collaborative space, but in particular, we want to talk today about the Violence Response Public Health and Safety Team, the VR-PHAST team. We have a parallel effort going on for overdose response as well, and we can certainly circle back at a future meeting to provide some updates on that particular piece. So I'm really here representing the overall group as well as the facilitation team that is leading this effort, but we wanted to make sure that we were sharing both some of the parts of the initiative that are happening, what brought this about, but then also set the stage to be able to continue to circle back with through the CJC, through the meeting of the whole, to make sure that people have an update on the progress and the things that are happening under this initiative. So with that, what I'm going to do is set the stage a little bit and then talk a little bit more about how this group is functioning and what the focus has really been so far. So I think we're all aware that 2020 was an unprecedented year in terms of the number of homicide and non-fatal shooting victims in the city of Milwaukee and in the county as a whole. If we look at the city in particular, we had an increase of about 73% in the number of victims compared to 2019. And you can see a longer term history on this chart. 2019 was actually a relatively low year over recent history. And then 2020 was a pretty significant jump in the number of victims. When we look at what's been happening so far this year, year to date 2021, we are on pace to exceed 2020. We're up about 22% in homicide and non-fatal shooting victims through the end of September for 2021 compared to 2020. But that is not at all a reflection of lack of effort. There has been a lot going on to try to work collaboratively, as Chief Norman indicated, on how can we bring different partners together to address the violence that we're seeing within the community. So just to give you a little bit more detail, when we look at the months so far this year compared to the 5-year average from 2016 to 2020, you can see that the gray line on the top chart is an indication of the 5-year average. And you can see that each month so far this year has exceeded that 5-year average. We did, if you look at the chart on the bottom, we did actually see in June and July a dip over what we would have seen last year as well as the previous months. But we've had some increases again in August and September. And that is certainly been the focus of this particular team, as well as a lot of the individual agencies and organizations that are comprising this Violence Response Public Health and Safety team. So just to orient you a little bit, this really was centered on the recognition of violence as a public health issue and putting that public health lens on what we're seeing from the violence happening within the community, but also really recognizing that we need a much wider range of perspectives and expertise at the table to address what we're seeing. I should situate this as well, that we are certainly not the only major city in the country that's experiencing some of these increases, but that doesn't negate our response to it in terms of wanting to have a direct impact on reducing the violence that we're seeing across the community within Milwaukee. So the orientation for this was really to build it off of the experience of the Unified Emergency Operations Center that was developed under COVID, but then also drawing on a variety of other initiatives and efforts that are currently underway or things that we have learned from other organizations or other similar initiatives. And you can see some of those listed on the screen. And then part of this was looking at how this is also an aspect of supporting part of the implementation of the Blueprint for Peace, and in particular, Goal 6, strengthening capacity and coordination of violence prevention efforts. But there was really a recognition about last summer that we needed to do something different and respond a little more real time to what we were seeing and think about how we can coordinate and share information in terms of the immediate response, but then also be thinking about how that fits in with longer term prevention opportunities. So this gives you a visual of the three primary goals of the VR-PHAST. A lot of it is about improving communication and information sharing, and that's really been a core tenet of what's been happening so far with this group. But then through that process, identifying resources and unmet needs. So what are some of the critical areas within the community where we either have resources that can be brought to bear on the various violence issues that we're trying to address, but where do we also have unmet needs, and how can we then seek resources and funding to help address those needs? And then looking at how we can bring that all together in a more coordinated and enhanced response to the violence issues that we're seeing. So you can see we actually have a mission statement, and it's really about bringing together those multi-sector partners across public health, public safety, and really beyond to try to reduce the volume that we are seeing in terms of homicides and non-fatal shootings, but also the impact that that firearm violence is having on individuals, on families, and on the community as a whole. So what's been occurring is very regular meetings and communication. For the most part, for a number of months now, the meetings have actually been occurring on a weekly basis. Part of what happens through that process is a review of data and looking at what has occurred in the time period since the previous meeting, talking about specific situations and the need for response, or what has occurred in terms of response to immediate situations. But then looking at both those short-term needs, what are some of the outcomes that we need in response to the communications that we're having about events that just occurred, or in some cases about events that are coming up. So we did, for example, have a number of discussions in planning for the 4th of July and other holidays this summer, so that we could have more of a coordinated response going into some of the events to try to prevent violent incidents from occurring. Then at the same time as we're looking at those short-term response needs, we're also trying to identify longer-term prevention opportunities and things that we can learn collectively by bringing all of these different sectors together to see where do we have gaps in services and resources, what are some of the prevention strategies that may help us in public health language to think further upstream about what we can do to change the trajectory to hopefully prevent future violent incidents from occurring. And again, this is a multi-sector approach. This is intentionally called the Public Health and Safety Team, but it's really rooted in the idea of thinking about violence from a public health perspective. So this is actually a chart from the CDC, and I won't spend a great deal of time on this, but I think it is helpful to situate the fact that violence really has lasting impacts on all aspects of our community and on health in particular. So it affects people both in terms of disease outcomes. It has an impact on maternal and child health. It impacts mental health. And all of that is part of the focus of understanding how violence really is a public health issue that is affecting so many aspects of our local community. So we spent some time with our VR-PHAST team early in the process, and then this is something that continues to situate the conversations in thinking about levels of prevention. So we're not just talking about what do we do in response to situations that have already happened, but how do we think further upstream about what we can do to make change before those health outcomes or those violence incidents occur to try to prevent them in the first place. So things like addressing the social determinants of health as they relate to violence. How do we think about not only immediate needs that individuals or families, for example, might have for housing after an incident occurs, but how do we make sure that a key factor of health, such as housing, is addressed more globally to help from a prevention standpoint? We've talked about secondary prevention opportunities, thinking about how can we slow the progression and the spread of violence through intervention? How can we do things that will make it less likely that things that are occurring now will continue or will spread further throughout our community? And then certainly tertiary prevention, which is much more about the response after the violence occurs. So how do we improve outcomes? How do we impact the quality of life for individuals and families that may have been impacted by violence? And in totality, looking at these different levels of prevention gives us more opportunities to think about how we can make change and really focus on the needs at multiple levels so we can do both short-term and longer-term response. So this just gives you a few examples. I've talked through this a little bit based on the last slide, but if you think about things like public health messaging, crime prevention approaches such as environmental changes, those can be more on the primary prevention, a little bit further upstream, where something like doing advocacy work after a situation occurs and working with victims as they move their way through the criminal justice process is more tertiary prevention. And what I will tell you is that we have ideas and what we're calling action items at all three levels of prevention that have been coming out of the discussions, the information sharing, and really the focused collaboration across different sectors through this VR-PHAST process. This gives you a picture of the way that we've organized the thoughts around the organizational chart for this.
I don't know why I didn't have this meeting.
No, it's okay. It was supposed to be.
Sorry about that. The organizational chart that we have for the structure of this particular initiative. We've actually been really since the inception working on reconceptualizing this a little bit so that it doesn't have quite such a top-down feel to it. But we're really just looking at making sure that this is a very broad group that has both a policy and guidance direction, which are indicated by the circles on the top of the screen. But then we also have the key implementation across both public health and public safety sectors to make sure that we are bringing together a variety of different expertise and resources to address violence issues within the community. In terms of the structure of how this is working, we have a facilitation team, and that team meets on a weekly basis to plan for the larger group meetings and really set the agenda for how things are going to be carried out, what data we're going to look at, what main questions or incidents we want to make sure we're discussing. We've been developing a data team to be able to support the data work surrounding this initiative. And then in totality, this really comprises what the VR-PHAST team currently looks like. One of the other areas, so in thinking about what's been coming out of these discussions, we really are taking kind of a multi-layered approach, with one of them being a place-based approach to what we're seeing within the community. So we have a focus area that's been identified, essentially the area from Capitol to Vine, from 50th to 10th Street. It's about a 6 square mile area that has pretty routinely had about 40% of the victims for homicide and non-fatal shootings within the year-to-date information, and also some similar patterns from prior years. So with approximately 40% of the victims occurring within this particular area, relative to the population, it's very disproportionate. So about 15% of the population, based on the census tracts, are within this geographic area. So what we're working on now is more in-depth analysis of what's happening within this particular area. Not that we're excluding other parts of the city by any stretch, but we're trying to really understand more at a micro level what's happening within the area, and looking both at where there are challenges in terms of areas of concentration, but also where there are opportunities and where there are strengths within the area to help build up the response in terms of the homicides and non-fatal shootings, and thinking about it again from a prevention standpoint. So out of the discussions on a weekly basis, we've been tracking what we are calling action items. And I'll tell you that there's well over 50 individual action items that have come out of the process. But what we decided to do is organize that around common themes into what we're calling action teams. And the goal of the action teams is really to move those action items forward. And those action items, again, can occur at various levels. They can be more the tertiary prevention that we were just talking about in terms of response after incidents, but they can also be much more primary or secondary prevention focused on things that we can do that may reduce the likelihood of future incidents occurring. Just as a couple of examples, we knew that we needed potentially some funding to support some of this work. So we did apply for a grant through the Bureau of Justice Assistance at the federal level. We have not yet heard about whether we were selected for this particular grant award. There's some delay in awards being announced at the federal level. But it was a collaborative application between the police department, the Department of Health and Human Services, the health department through the Office of Violence Prevention, and then the Medical College of Wisconsin, to provide some foundation and some support for the VR-PHAST work, including setting aside some funding for the implementation of some of these action items and to support some of those community level initiatives. So we are still awaiting that. If that one's not successful, then we will go and seek additional funding to help support the foundation of what we're doing under VR-PHAST. Just a few other examples out of the more than 50 that we have coming out of this team. One that we've seen in a variety of different permutations has actually been the connection with the Milwaukee County Housing Division. And some of that has been addressing immediate housing needs for individuals or families who were victims of violence, but also thinking about other opportunities for housing related needs to address some of our particular needs within the community from again, social determinants of health standpoint, and thinking about the safety and security of many members of our community. Another action item was identifying youth who disengaged from school during the pandemic and looking for ways to re-engage them. And that has actually developed into a variety of different areas and also a lot of communication centering around safety within the schools and making sure that we also have good opportunities to re-engage with young people who may have disengaged for a variety of reasons over the last year and a half. And then enhancing our communication with first responders in schools when violence impacts one or more students to support more immediate outreach. So looking at ways that we can make sure there's good communication happening so that students who may have been either directly or indirectly impacted by violence have more resources and communication happening to support their needs under those circumstances. So those are just a few examples. Wanted to just make sure we were sharing a couple of concrete examples of things that were coming out of the discussions. But really, it's all about the information sharing and the collaboration that's happening on a regular basis, many of which are connections being made through these meetings that then continue in communication outside of the meetings as well. So I mentioned that this has been coalescing around action teams. We ended up with initially 7 action teams being identified, but we determined that just partially through capacity for everyone that's involved in this work, since this is really, everyone is contributing effort on a very regular basis, just as part of their commitment to trying to impact and reduce violence across the city and the county. So we decided to start with the first 4 action teams. So those are the gun violence interruption and mediation, trauma response and healing, youth and young adult engagement, and then referral process and resource documentation. So those 4 action teams are kicking off actually pretty formally this week, and all have different action items associated with them and are bringing in additional resources and expertise to those particular topics to make sure that we can have really directed discussions, but also can see good movement on the action items that have been coming out of the VR-PHAST work and collaborative efforts. So I'm going to pause here. I know we have multiple members of the facilitation team on the call, as well as the overall team. I want to make sure that I give the opportunity for others to weigh in and also open it up for questions.
Connie, do you want to go back to the regular screen so I can see who might be out there?
Absolutely.
Hang on one second. Get it into a gallery view. Any questions?
If I could just make a quick comment. I just want to say what I love about the VR-PHAST is talk about not only collective work, but getting to the root causes, being more proactive rather than reactive, which is something that we should all be striving for. So I just want to thank Connie and her team and everyone else who's part of this effort, that we're being in front of it rather than being in behind it. So just want to put that in there.
Chief, thank you for that.
This is David Muhammad. I just wanted to just kind of give an example of real-time responses to situations. We had a couple of responses to Bradley Tech and Marshall High School that were coordinated in conjunction with VR-PHAST, with Office of Violence Prevention and Milwaukee County's Credible Messenger Program. In addition to some of the things that we saw happen last summer with incidents at the beach, and how we were able to really have multidisciplinary conversation. I'll put it like this. The ability to talk to the sheriffs and the police and kind of make sure that we inform in a positive way the type of strategies that would de-escalate situations versus create community tensions is a real important dynamic of this group. And what we look forward to in the future is really expanding the community table to make sure that that voice is equal in power sharing with a lot of those sector partners as well.
David, thank you for those comments, as well as your advocacy on this VR-PHAST and the Department of Health and Human Services. Other comments, questions?
Yeah, Judge, this is Chief Parrish. I just wanted to also interject something, and I apologize, I was kind of a late joiner for the meeting, but I think one of the other really powerful parts of this conglomerate is that we all bring different specialties, which I think is kind of apparent, but also kind of one of those back-end things that's not often talked about is we all have different rules of engagement as well. So when it comes to, doing referrals, information sharing, privacy standards, rules of the roads, what I've learned is that I think what was generally thought is that we're all kind of on level playing field, and the reality is that we're not. There are different things and information and insights that the medical examiner can bring that law enforcement cannot, different things that EMS can do that, maybe the judiciary system cannot. And really having that cross collaboration really opens up some very unique opportunities and brings those skill sets, levels of expertise, and just like ideas to the table. Which kind of to what Mr. Muhammad just said has really increased our level of ability to respond, and also the creativity that we can bring to some of these really nuanced situations to hopefully bring them to better resolutions, and as previously mentioned, to work to prevent not only future incidents but also incidents that have already occurred from increasing in their gravity and potential to do harm. So it's really been a blessing for me as a fire chief to learn a lot from the partners, and then to be able to offer some of the things that we have to the broader system. So it's been an amazing journey thus far, and I'm really looking forward to continuing our relationship.
Yeah, Joshua, thank you for those comments. I know not only the byproduct of this is bringing people together, but introducing people to other systems. And I know the courts have had conversations with the Milwaukee Fire Department, right? And have learned unique things about how we might be able to work together to help our community. So I think the sky's the limit when you bring a group of individuals together who have the same goal in mind, but can bring different perspectives. So thank you for that comment. Other thoughts and comments? I think I have Jamie DeJesus Sr. You want to make a comment?
No, I was just celebrating your comment about bringing people together.
Good. That's okay. We like celebrations too. It's a hard work, right?
Absolutely. And you know what, since I'm on here, I have a whole new view on coming from one side of the fence and now finally discharging off supervision after so long of the just the teamwork and the general purpose of keeping the community safe. And I just want to thank you guys for for your service and for risking your lives out there every day, to make us safe. So thank you.
Jamie, thank you for the comment and congratulations. Other comments or questions? Okay. I know this is a pretty unique grouping of individuals across the country. I think there may be one other location that we looked at to try to do a model of our work, but I think given what we have pulled together under the leadership here, it is pretty unique, and we're hoping for a great result. So Connie, I know you did some reviews across the country about some of this work. You want to just say what you found?
Yeah, I would say that, there's some similar initiatives happening in other places, but part of what's actually really unique about this one is that we didn't have any funding to get it started. We really pulled from existing resources and from the commitment of all of the agencies and entities recognizing the need to work together and to do things differently. That obviously comes with its own challenges, but ultimately, I think it really shows the the strength and the commitment of the various organizations that are participating in this process, and just recognizing that it was really critical for us to come together and communicate differently if we were going to hope to make change. So that says a lot. And I think it's an important part of why we've really had great commitment and participation. To ask a lot of these agencies to commit to an hour a week is not easy. And then all the work that happens in between. So it's, I think, a testament to the many organizations that are participating in this process.
I agree, Connie. I think you have one more slide, you said? You want to do that?
Yeah, I actually would like to, if I could, turn it over to Reggie Moore to just give a quick update on the ARPA funding for violence prevention and how that ties in with all of this collective work that we're doing.
Right, thank you. Good morning, everybody. For those who don't know me, Reggie Moore, I direct the Division of Violence Prevention here at the Medical College of Wisconsin Comprehensive Injury Center. Before diving into this slide, I also just want to underscore the importance of continuity and connecting the dots. And so I know that many of the agencies that are on this call also stood together in January of this year to declare gun violence a state of emergency in the city, and talked about the unified approach that needed to be taken. And so looking at VR-PHAST come to fruition and all of the amazing work that's coming out of that collective is extremely inspiring and critical, especially if we want to respond the same way that we responded to the COVID-19 pandemic at the beginning, in terms of that sort of coordinated approach. And then secondly, underscoring goal 6 of the Blueprint for Peace, I think, is also important, because oftentimes we have different initiatives or different plans and then something else comes along. But this is an example of what continuity looks like, and what the blueprint in action looks like as well. So I'm honored to be a part of that, and really excited about the announcement I'm about to cover here on this slide, which many of you may have heard. I think it's been about 2 weeks ago now. Governor Evers announced his priorities around violence prevention, particularly as it relates to ARPA, and that investment, basically what we would call a four-legged stool. One of them focuses on establishing a statewide violence prevention fund. That will be a $10 million fund that will be administered for communities across the state to apply to implement public health-driven approaches to violence prevention in their communities. And so there will be an entire planning process around that, but the hope is to have the application process for that launched early next year. And that will be administered in terms of the technical support and assistance for developing that process within the Division of Violence Prevention here at the Medical College of Wisconsin. The second leg of that stool focuses on providing direct funding to the City of Milwaukee Office of Violence Prevention. They had a have a $16.8 million request for ARPA support, and Governor Evers committed $8.4 million to provide half of the support for that request. The next leg of that stool focuses on basically funding the Medical College of Wisconsin to provide technical support to communities throughout the state, both that receive the grant funding, but also or cities or municipalities that do not, but are interested in replicating some of the work that we're doing here in Milwaukee, and whether that's developing their own violence prevention plan, implementing a VR-PHAST model, implementing the Cardiff model, or any other type of technical support that they may need around data evaluation or research. We will be resourced to be able to provide that at no cost to those communities. And then lastly, there was an announcement by Attorney General Josh Paul and the governor to provide $20 million for increased culturally competent services and supports for survivors of violent crime. One of the things that we found, both through the work of 4-1 for Life, and particularly the hospital response component, as well as through VR-PHAST, is that many victims or survivors of violent crime are unaware of VOCA or how to access crime victim funds. And so one of the things that Josh Call noted is the fact that those funds at the state level from the federal government are diminishing at a time that our state needs them the most. And so it was really great to hear that announcement as a part of this sort of comprehensive, both prevention, intervention, and healing strategy around violence in our state.
Thank you, Reggie. I appreciate the update. Are there any questions for Reggie? And Connie, if you could go back to the screen, that would be great. Okay. We'll in a minute have another ARPA funding update from Jeff Roman from the Office of African American Affairs, but I do want to segue to introduce the Director of the Department of Health and Human Services, Shakita LeGrant, for her update on youth justice initiatives.
Chief Judge, good morning, everyone. Shakita LeGrant, Department of Health and Human Services Director. And I did just want to provide, I don't have any PowerPoints to share, but just wanted to give some updates of what's going on with our Division of Youth and Family Services under Department of Health and Human Services. So we have been working on some integration efforts and looking at how we can have an adult system of care and a children's system of care. And so as we focus on our children's integration, and the vision of that is really to create this centralized way for our children and families to get help no matter what their need or their ability is. So I did want to provide a couple updates around that integration and also on some work around our youth employment and incredible messengers. So with the children's integration, we're integrating our services as part of our no wrong door model so that we can have easier access for quality care and for our families who are seeking help. As we talk about our vision for Department of Health and Human Services is together we create healthy communities. So we know, as you have seen in the VR-PHAST presentation, working together to do this work. We do believe that right now, as we see what's going on across our county, we are in crisis, especially with our young people, and needing to find a way that we can meet them earlier. You know, as we talk about prevention and intervention and those type of things, just making sure that we can come together so we can address those needs earlier on, so our youth don't end up deeper in the system. And so as we think about no wrong doors, so that we can provide services to the people we serve across the lifespan, but again, starting at that earlier age, because we have birth to 3 services. So identifying if there's a need earlier on, getting those services in place, wrapping services around not just the child, the youth, but also the family and those who support them. And so as we think about, we are definitely committed to collaborating. We have many partners at the table, want to be at the table with each and every one of you, our providers in the community, so that we can achieve the county's, as we think about our population and our health and our racial equity goals, we want to be a part of that. It does take all of us in order to move the needle on that. And so for the children's integration, we are Division of Youth and Family Services, as many people know it today, as of January 1 of 2022, will become the Children, Youth, and Family Services. And so it would include our disability services for children. So our children's long-term support services, our children's community options program, and our birth to 3 programs. So they'll be under this umbrella with this dotted line, working very closely with our children's mental health and wraparound. Wraparound will be doing the assessments for the programs for the children's long-term support and our children's community options programs. So to be able to identify, as I said earlier on, are our youth, are they dually eligible? Are they eligible for other services? Can we get them connected to resources in the center, in the community? Can we get their families connected to support groups? It takes a village, as you all know, and so again, making sure that we're all at the table and understand what resources are available, and also that collaborative effort and that line as we work with also our Milwaukee Child Protective Services and our NPS and Department of Health Services. So again, that we're guaranteeing access to services and our children don't end up in that deeper end. So we did create a permanent centralized call center. We cross-train staff. They're actually being cross-trained now. There's a few that's already cross-trained to do the intake for those services. Building a great relationship with NPS, making sure, again, that we are out in the community, meeting people where they are, getting people connected, making sure there is a seamless continuity of care, and also that smooth transition as we think about children who are being served in the children's programs, and how do we make sure there's a transition to adult services programs, resources, and those kind of things. So there is a lot of work that is happening there. There's been a lot of research, as you all know, as we think about our Black and Brown youth who are likely more diagnosed with behavioral or conduct disorders than intellectual developmental disability. So we do believe having these services and programs under one area and being able to assess that earlier, right, that we get families connected. And so there's a lot of work that's happening there. And I just wanted to give you that update that we're in that phase one of moving closer to integrated services, meeting people where they are, wrapping services around, again, not just the child or the youth that we're serving, but also the family, getting people those resources that they need. So that's just one update that I just wanted to make sure, because we've been sharing our org chart. So I know there's a lot of conversation around that, and we'll be willing to share more information if needed, but wanted to provide that update. And then also, I also just wanted to let you all know that this year we did develop our first ever youth employment program. Shouts out to Division of Youth and Family Services. They led this effort, but they work really closely with other divisions under Department of Health and Human Services. So our disabilities services, wraparound. So making sure that we get all of our youth connected across the department to employment. We did work with several community partners, so that included Employ Milwaukee. We worked with the Social Development Commission, our Youth Advocate Program, and then Milwaukee Public Schools. We were able to serve 137 youth during the summer initiative. And so we're looking at, we did put funding in our budget to do the program again for next year. And we're looking at continuing to work with those partners as well as partnering with the parks and zoo. We do feel like we want to expand this program. So it's just not a summer program. We want to make sure that this is a year-round program. So we will be seeking additional funding, whether that's applying for grants or just figuring out how do we use additional funding or underutilized contracts that we have to make sure that we can move this work forward, because we want to make sure, again, that we help our youth as they build those community connections. We have them ready, those job readiness skills that they need, so that they develop a meaningful purpose in our community, right? That we can begin to turn that around. So again, that initiative was just for the summer, and we're looking to expand it, hopefully to have that throughout the year, but we do need additional funding for that. But we were really excited about that initiative. And we were able to pay more in that program. I know as we think about the Earn and Learn program, we did start our youth off, and that's ages 14 to 24 at $10 per hour. So we were able to pay a little bit more through that initiative that we had. And then I also, I wanted Deputy Director David Muhammad, and if there's others from a Division of Youth and Family Services on, just to give an update on the Credible Messenger program, what we have done, how it's implemented, and where we are today. Deputy Muhammad.
Absolutely. Thank you, Director LeGrant. Just for everybody's awareness, in summer of 2020, we started a Credible Messenger learning cohort partnering with the Professional Community Intervention Training Institute, PCITI. That included 11 agencies and 50 individuals were a part of that class. And for us, it was about establishing a baseline of training for people to do youth intervention work with young people who are involved in some of the incidents that we've seen with gun violence as well as auto theft. Later on, from that cohort, we looked at the organizations that had the greatest administrative capacity and staff capacity to immediately start working with a caseload of young people. And so we selected 5 of those organizations. That included 4-1 for Life, the Youth Advocate Program, the Milwaukee Christian Center's Violence Free Zone, Running Rebels Violence Free Zone, and their program that they have with regards to aftercare, and West Care with their youth leadership development programming. What we found as far as early outcomes, we launched this pilot in May of 2021 with those 5 agencies. They've demonstrated the principle that when you're working with young people in this kind of risk level, that higher investment really is demanded for the better engagement and to make a significant impact. And so we're evaluating this pilot. We're in the latter part of this year's phase, but it is a strategy that we are committed to, and we will continue to advance moving forward, as we really are about the business of building people and not institutions or buildings to house them in that regard. Just a brief profile of those young people who are participating in the Credible Messenger program. Of those 5 agencies, 70 young people from DYFS, and some who are community-based youth who are not in the justice system with a charge, but have been identified as being a part of a social network of young people. And I say that that's a fancy term. Basically, you know who's connected to who because they were in a passenger in a stolen vehicle, or they're involved in some level of group-based violence. We don't use the term gang violence anymore. That's a little outdated and pejorative. But we have about 104 youth, 40 who are on a wait list right now to be a part of the program. The referral sources, 58 of those have come from DYFS, 45 have come from both community and law enforcement. And when I say law enforcement, I'm talking about the Office of Community Education and Outreach, or OCO, Officers Ellis and Ron Edwards, folks who are dealing with young people in ways where they can get them out of the system earlier and into diversion. And 84 of those are male, 20 are female. The average age is 14 to 16 years old. 10 of those participants on the caseloads are between 18 and 20 years old. I know Superintendent Jewell is on. We're working currently to identify a way to do this for House of Corrections as well. Race, obviously, we see the similar trends of 87% being Black or African-American, with the remaining demographic second largest group being Latinx, and an amount of white youth as well. And far as the pilot implementation phase, just wanted to highlight a couple of quick things. The learning cohort is something that we are continuing. PCITI is staying on board with this work, as well as we're working with other partners to advance much more culturally responsive. We use the term restorative justice, but I prefer the term transformative justice. You can't restore what wasn't there to begin with for communities. And so we're working to have that training happen in November. We want to open it up to more agencies. We believe this is also a way to expand our provider and contractor base. And we intend to continue this. As far as the outcomes that we are evaluating, we are looking at desistance, meaning that youth will not receive any new charges of the same or higher severity. So we are looking at the steps and the gradient of offense, receiving the service, that youth will be engaged in a pro-social activity or employment or some type of community service work. Through this, as well as ongoing, they can maintain the relationship with the credible messenger afterwards, and that youth will be receiving a minimum of 26 weeks or 78 hours of time with the credible messenger. That's research-based to be the minimum required amount of youth service to make impact. And lastly, while this is self-reported, we are monitoring to make sure that these young people are not hurt, re-injured, hurting somebody else. And while this is a small section or segment of the community, we believe that if we can show efficacy with this group right here, and it does cost to do this type of programming. Again, intensive work costs money for a higher risk population. But if we can serve them in the community this way, then we don't have to serve them at a more expensive rate in a carceral setting. I know Director or Administrator Mertens is on. I don't know if you have anything else to add, also being mindful of time.
Thank you, David. No, I don't have anything else to add. I'm as encouraged as you are about the early outcomes we're seeing. I think this is a direction that obviously makes sense and resonates here in Milwaukee. We're hoping to continue to reduce our carceral commitment of youth and reinvest more in programs like Credible Messengers.
I think there's a question. David, do you have a document? Oh, you're responding. Thank you.
We have a lot of, there's a lot of, what they call white papers and all types of other documents, but we do intend to report out the outcomes and the challenges as well as the funding opportunities. We do envision this being something that demands greater public-private partnership. And given the level of violence that we've seen this year, we want to make sure that people are investing in young people adequately.
Thanks. Okay, Shakita and David and Mark, thank you for your leadership and your foresight on this. It's much needed. Any other questions for them? I'm sure we'll have you back up for a report out on outcomes. And I know this is plugged into VR-PHAST as well. So I appreciate all the hard work on your end.
Thank you.
Okay. If there are other questions for them, you can put it in the chat as well. I'm sure they'll answer. All right. Let's go to another ARPA update from Jeff Roman from the Office of African American Affairs. Thanks, Jeff, for being here.
Thanks, Judge Trigiano, and afternoon, members of the CJC. Good to see you all. Good morning, I should say, not afternoon. Just want to give a quick update. I think this update actually aligns to the conversation that you all are having about investment in Milwaukee, particularly use of the federal American Recovery Acts that are available and accessible to communities. So I just wanted to just inform this body as we are making our rounds to all of the county boards and commissions, community partner organizations, and the broader community, sharing the opportunity that exists for Milwaukee County and spending those dollars. And so if you didn't know, the Milwaukee County has established a county ARPA task force that has been active since the end of August of 2021. And I'm a member of that commission along with a number of folk from the county, but also from the community, co-chaired by Mr. Ricardo Diaz, the former leader of the UCC, United Community Center, and Supervisor Sean Rowland here from the county, as well as other folks from the administration who are part of that team. And we have been working again since the end of August to frame the county's approach for spending the federal recovery dollars and making sure that that approach is aligned to the vision, to the services, and to the work, the priorities of Milwaukee County. There's also a robust community engagement framework that the ARPA Task Force has developed. And my office is leading the charge in making sure that we are actively and authentically engaging communities who have been most impacted by the COVID-19 pandemic, particularly Black and Brown communities, and other vulnerable and marginalized communities, and have created a real interactive, iterative community engagement process that will be sustained throughout the duration of the funding period through 2024. And so I just want to just share a little bit about some of the community engagement work that we've been doing to date, and want to make a request that we're able to extend that community outreach and engagement to this body and your networks and committees, so that they have access to be able to share their ideas and priorities for the spend for the county. And so to date, we have been participating in a number of town hall meetings with our supervisors, our county board supervisors across the county. And we'll continue to do that as we are going through a parallel process of defining and approving our 2022 budget. So that's happening. But also, as mentioned, we are also actively engaging the various boards and commissions and extended agencies of Milwaukee County. And so, for example, this week alone, my team and members of the ARPA Task Force are going to be presenting and sharing similar update to our County Mental Health Board, our Commission on Aging, our Intergovernmental Cooperation Council, which is the association, or not the collective of municipal leaders, 19 municipal leaders across the county, as well as the Social Development Commission, and the Combined Community Services Board just this week. And we'll continue that outreach and engage. And what we recognized was that there are extensions into the community that sometimes we often omit from the process. And so we wanted to make sure that we were tangibly engaging those communities, and we'll continue to do that. We're also going to be working with a number of community partner organizations in those hardest hit communities to schedule, we're calling reverse town halls in November and December. Again, just to share framing, share information, and make sure that our community, the public, is aware of the vision, the services, and the implication of the dollars on our vision and our services. We're also going to be working along with my colleagues and at the Department of Health and Human Services and other departments. There are going to be a number of service area groups that will include not only system level folk from the county and focus area work across those issues that we are responsible for providing, services that we're responsible for providing as a county, but but also to engage community. And so these service area teams across those focus areas will be constructed by community and government partners who will take all the information that we get in real time from the community and apply that learning, apply that input to define and develop strategies, actual strategies that we can make investments into. And those recommendations will be forwarded back to the Arpa task force, who will then in turn make recommendations to the county board, who will have the final approval of expenditures for the Arpa dollars. I want you to know that we're going to take our time and do this process intentionally and thoughtfully. We're not going to rush as some of our as you see other communities here and across the country, they're rushing to spend these dollars. We're actually going to do ours a little different. One, because we have a smaller amount of dollars, but two, we really want to make sure that we are really engaging and hearing and involving the voices and lived experiences of communities that are impacted, that have been impacted by COVID-19. And so we're going to take our time. And right now, our focus is just on sharing the opportunity, sharing, letting people know what it is, what the amounts are, what the priorities of the county are, and then making sure that those priorities are aligned to the priorities and the aspirations and the need of the community. And we're going to do that across 4 areas. And so I want to just share what those 4 expenditure areas that Milwaukee County and the task force have determined just to frame our spending. The first category is around revenue loss recovery. To be able to sustain the work of Milwaukee County and the services that we are mandated to do that have been really impacted as a result of the pandemic. The second category is on COVID-19 mitigation, which is really focused on emergency expenditures that are actively being expended right now. And so departments are actively making proposals and extending proposals to the task force to be able to address the immediate needs, the ongoing needs that have been resulted from the pandemic over the last year and a half. The third category, which is one of my favorites, is community support programs. And we have designated a significant portion of the ARPA allocation to be able to go directly into community. There's also the primary bucket where we're going to be prioritizing the input and the voices of community and defining what those dollars are for. And so this is going to be the area where those service area teams that are going to be, again, co-constructed by government or county and community members. This will be the bucket of dollars where they are going to be able to actively define and be involved in defining specific strategies, specific projects to be able to use those dollars. And then lastly, there's a bucket, the last category is around community engagement and fund administration. We are investing significant resources to go into this active iterative process of engaging communities and engaging them in ways that we can inform them, hear from them, listen to them, involve them in the planning and decision-making process, and then building their capacity, building their leadership, building their organizational, and building their advocacy capacity to be able to directly impact and mitigate the impacts of the COVID-19 pandemic now and well into the future. So those are the 4 categories, which leads me to this. I'm sharing all of this because we want to make sure that this body and those who are listening and who are part of the network of the Community Justice Council are aware and know that they are invited to share their ideas. We want to hear your ideas, many of which have been shared today. We want to make sure that those ideas are coming into our process that we have developed for the COVID-19, for the recovery dollars. And I'm going to share all of this information that I'm sharing with you. You can find on the county's website on our ARPA County ARPA Task Force landing page, which I'm linking into the chat right now. You have an opportunity to look at the presentations, follow the work of the ARPA Task Force, look at our community engagement framework and strategy, look at the various expenditure categories and what we have prioritized as expenditure areas aligned to those categories. And you have the ability to be able to submit your ideas, your strategies, your proposals for county spend. And we just wanted to make sure that you had an opportunity, know that we're extending the opportunity and want to make sure that you're aware that you have the opportunity to do that. And so I'll just end by saying our next county task force is on this Friday morning, I believe at 8 or 9 o'clock a.m. I'll also link that information so that you have access to that And we want to make sure, again, that the community is aware and are full and equal partners in this process. And so we wanted to make sure that we got on the agenda just to share the county's process and what we're doing and how we're doing it and how we're going to take our time and be thoughtful and intentional about use of these dollars to help coordinate and strategize to make maximum impact. So thank you, Chief, and thank you, members. And if you have questions, let me know in the chat or send me a message. Happy to respond to those questions.
Jeff, that was a great summary, and I don't think you even breathed once during your entire presentation. But lots of good information, and I appreciate you putting the information in the chat. Any quick questions for Jeff? I'm sure he's always willing to answer them, whether you call him, email him, put it in the chat. Lots of great information on how to access that. Okay.
Thank you.
Thank you very much. Thank you. Okay, so last spring, Reggie Moore asked the Community Justice Council to convene a public forum of sorts to discuss, among other things, sentencing and other racial disparities in the criminal justice system. It was intentionally a focus on the sentencing of Joel Stryker, who had killed Caesar Stinson and had pled guilty and was being sentenced in the court. We agreed to take that on. I think it was important for the CJC to do that. We had many, many meetings. Among those meetings included meetings with Reggie, Jeff Roman of the Office of African American Affairs, the CJC Community Engagement Committee, chaired by Pastor Walter Lanier, was instrumental in working on putting together what ultimately became a town hall meeting in June. The input culminated in several different pieces to the town hall meeting. The family of Caesar Stinson was notified that he would be honored that day. They were participants. They were allowed to speak, honoring Caesar and having discussions about their feelings related to what had occurred in the courts. We also engaged retired Wisconsin Supreme Court Justice Janine Geske, as well as retired Federal District Court Judge Charles Clavert, who talked about how judges sentence, what they have to look at by law, by case law, the various pieces of sentencing. And then we moved into what I thought was probably one of the most important parts, was breakout sessions, which were facilitated by Zilber Foundation, with a report out afterwards from them about what had occurred during the breakout sessions. The report that they put together has been sent out, I think, in the also in the agenda. Mandy put a report link so that you can go into and take a look at that. And there have been a variety of discussions about next steps. Those discussions have been really launched from the standpoint of the CJC's Community Engagement Committee under the leadership of Pastor Walter Lanier, because we believe that's what is most important right now, is input and voices from the community about next steps. And so I know Walter is here, and I'm going to ask him to speak a little bit about what I just said and the process and the potential for next steps, and then open up for a brief discussion for this community meeting of the whole to add your voices to the potential next steps and what we do in the near future in terms of another public forum and or other possibilities. Walter, are you there? Andy, I'm looking, I thought I saw him earlier.
He was definitely here earlier. I'm not seeing him in my 3 pages of screens here, though.
All right. So I guess we will open it up for some discussion about the potential next steps related to another public forum or other. And is anybody else from the Community Engagement Committee on? Okay.
Sorry, I didn't realize my camera was off. I am looking. I'm not seeing anyone here.
All right. That's okay. Thoughts about moving forward? Any input? Certainly, we are willing to have further discussions about what that might look like and add those to the discussions in the community engagement meeting.
Yeah, I have some input. So where I work at Innovative Educational Solutions, we have training for manufacturing that maybe we'd be able to help use as that keeping the youth and community members engaged in learning something, at the same time getting job placement as well. I also have a podcast with my business partner, Kim Malone, and for the youth, she has something called Reality Check by Kim. I reached out to Ms. Shakita LeGrant, the director, and Mr. Muhammad, and I'll be following up with them after the meeting. But I just wanted to let everybody know out there that we are in the community. We're a community-based organization for MATC. And if we can help in any way to help, just give the youth in the community something to do, something to look forward to, so they have some, something to believe in at the end of the day. And more, even more so to help believe in themselves. Innovative Solutions is here to help you. So I just want to put that out there. I'm gonna put my email in the chat if anybody would like to follow up. And thank you for your time.
Jamie, thank you so much for suggesting that. I appreciate you putting your information in the chat as well. Okay, so the Community Engagement Committee will meet and we will plan next steps in terms of moving forward with potential new public forums related to race equity in the justice system. And anybody certainly can send me, Mandy, Walter Lanier, Tom Reed, your ideas and thoughtful input related to what we need to do to address some issues in the justice system. Okay.
I'm sorry, there was one more thing. I just got a text message, I'm sorry, from Shannon Ross in the community. He wanted me to make mention of the hearings for the free phone calls. I believe there's something going on right now where county jail is going to be giving free phone calls to inmates when they come in. I'm going to see if I can forward the link that he sent me, and I'll post it in the chat before we're done. But I just wanted to make everybody aware that that's supposed to be in the works.
Sure. Thank you, Jamie. Reggie?
And Chief Judge, if I, just to chime in about the forums and kind of next steps, one thing I just want to point out or underscore, I think the intention or call for the original forum was to understand how the disparity in that particular sentence occurred, and to also understand, is that a problem across the entire system, whether we're talking about, but particularly in that particular instance, it was vehicular homicide, but understanding there may be disparities in other types of charges. At the end of the day, I think in terms of what I want to implore both to the CJC as a whole, but also the Community Engagement Committee, is to talk about how that feedback will be applied to actually inform change. Whether it's the way that, in terms of with judges, with prosecutors, I think we talk about these issues quite a bit. And I definitely appreciate the CJC's leadership in organizing that forum. And I think it created a very important platform for that conversation. But I think we also have to get to a point where we're acting on the feedback and input that we're getting. And I understand that there's also state laws that affect what judges can and can't do as it pertains to sentencing and other guidelines, even with how where he was doing his time as far as that deputy. And so these are all things that, again, continue to perpetuate trauma that we just have to have a long-term commitment to addressing. So I just wanted to not have us pivot from this conversation without just laying that out.
Yeah, I appreciate that, Reggie. Thank you. And you know, the CJC has been having certainly discussions across the board about what are we doing currently, what are the courts doing currently to address those kinds of issues and/or issues related to implicit bias, racial disparities, et cetera. And how can we at least get that information out, but how can the community work with us to address some of those issues as well? I think, yeah, Mandy's indicated sharing widely what we are currently doing to try to address our system and institutional issues, while noting we have a long way to go. So, and I know you, Reggie, you and I have had several conversations about some of this, so I appreciate you keeping it in the forefront. And I think the CJC is the perfect place to have these conversations and to try to make change and move forward. Okay. Any other announcements, information like Jamie had, or other issues before we close?
Hello, everyone. My name is Gwendolyn Luckett, and I am with America Works of Wisconsin. I am the child support liaison, and I would like to assist non-custodial parents, second parents, which would be the parent that does not reside with children. We are helping parents out with Pampers or employment, career training, or just support. So we're here for non-custodial parents in your reach. And I will also add my contact information in the chat. And I hope to connect with all of you soon. Thank you so much.
Thank you, Gwen.
I have just a couple of quick announcements for our group this morning. First, one thing that has happened during the pandemic is that some of the traditional arrest patterns have changed. So for example, people who have police contact, which results in a misdemeanor charge, are not being booked into the jail with the regularity that existed prior to the pandemic. And subsequently to the police contact, someone would get a notice indicating that they need to come to court to make an initial appearance. And what we found is that a lot of people did not either get those notices or were not able to make their court appearances. And I think routine court appearances also have been affected by the pandemic for a variety of different reasons. And what I just want to say to anybody who's in the meeting this morning is that if you contact the Office of the Public Defender and indicate that you personally or somebody that you're working with has a unresolved issue, warrant issue, we will work with that individual to try to get their case reset in the court system and get that warrant cleared. And it's really important that that happen because, as we know, the existence of a warrant can hold back an employment opportunity. It can psychologically affect somebody so that they don't pursue opportunities that would be beneficial. And I just think we have to recognize, and the courts have recognized, that during the disruptions with the pandemic, a lot of people just disconnected from some of their court obligations. We want to really help them reconnect so that that can be cleared. And then the second thing I'm going to mention, because some of you may hear about this and may wonder, the Office of the State Public Defender has the obligation to appoint lawyers for people who are eligible. And when we look at our court system, we find that the vast majority of people who are charged with criminal charges, who have juvenile delinquency matters, who have termination of parental right matters, these are people who, in large percentage, we're appointing lawyers to represent them. And again, not solely because of the pandemic, but in part because of the pandemic, we've experienced for the first time an unparalleled shortage of lawyers able to take our cases. Our staff is taking everything they can. We have private bar attorneys who take the overflow and conflict cases, and there just aren't enough lawyers to do all these cases, and that's leading to delays and problems. You certainly can, on your behalf, on behalf of somebody you're working with, contact our office, and they will probably send you to me or to one of the managers to try to work on a appointment delay. But I just want people to be aware that we are facing that problem with the help of and cooperation of the Chief Judge and Milwaukee Bar Association, lots of other people. We're doing everything we can to increase the capacity to provide lawyers, but it is a justice system, social justice problem, which is having a big impact. And I just want to note it, and we're not running away from it. I want to hear from anybody who sees the effects of it, and we'll do our very best to try to fix the situation that you bring to our attention.
Thanks, Tom.
Chief Judge, can I share something as well?
Sure, Clarence, go ahead.
Hi, everyone. Clarence Johnson, Wisconsin Community Services. Many of you probably saw on the news yesterday that the governor was in Milwaukee and he was visiting a program site for WCS. It's our hub and spoke pilot program site. And the hub and spoke program is designed to address substance use issues for individuals and other co-occurring needs as well. It's something that will impact many of the things that we've talked about this morning, whether it's violence, homicides, it's just, it undergirds many of the problems that we face in our community, unfortunately. So I'd like to, at some point in the near future, have one of the hub and spoke staff on the meeting of the whole and share how the program is operating, who's eligible and how we can access it. It's an innovative way to address substance use issues and needs by providing a health home, which is a hub, in this case, WCS, working in conjunction with a number of spokes in the community, other systems that folks who have that issue need to be involved with. So it'd be great if I could, again, have one or more staff meet with this group and share how the program is functioning. And more importantly, how folks can access it and how it really fits into what we're doing to move forward in our community.
Great, thanks, Clarence. One last announcement, comment, question.
Judge Trujano, this is Connie, just to circle back on our conversation with VR-PHAST earlier. I just wanted to let people know that we will be doing additional outreach and connection as these action teams move forward. We continue to identify additional partners and resources that are important for the process, and certainly want to see additional involvement as we head into our planning for 2022. And as David indicated earlier, part of that is also expanding how we communicate more broadly about what's happening with VR-PHAST and make sure that we get additional voices into both the planning and the response to violence within the community. So if people get an email that says VR-PHAST, know that's where it's coming from. And if there's questions, please don't hesitate to reach out.
Great, thank you. Okay.
I have something to say.
Jarvel.
Can you all hear me?
Yeah.
Hi, I'm Jarvel, the Racial Equity Coordinator for the CJC. I saw that Mandy had put it in the chat, but I really wanted to plug it my way to this group, because I really, really think that if all of us truly understood the impact of this sub-grant that the CJC is giving out for community investment for racial equity organizations, this is an implementation grant. It is not used for lobbying or any legislative, enforcement or things like that. But this is for you to do what your program is trying to do in the community. And so the deadline is November 5th, I believe. And the opportunity is right here. So please use it. Please use it. I think that community engagement is a topic that we often discuss and forget about often, but it's not something that we truly have the funds to really work out and experiment with often. So please, please, please do what you can to just apply.
shoot your shot, and we can do this together. I really think that that's an important thing to say because you never know.
Sure.
All right. So thank you.
Perfect, Jarrell. Thank you for that. Appreciate it too. Okay. We're finishing on time. Thank you, everybody, for your input and for being here. Please keep safe. We will continue to communicate with you. Please continue to communicate with us your thoughts, your wishes, your hopes, and concerns. We are always available to get input from you either by phone call, voicemail, email, etc., or text. Thank you so much.